Thank you, Alexey Sergeyevich, for presenting me, for introducing me to the audience. A lot of things have already been mentioned, but that's why I would like to be brief and to speak about the experience that we have. Since 2009, we have been collecting data of the real clinical practice, and for 12 years, we have been in collection of information, processing of information, and I will very shortly try to describe the 12 years of our life spent on the work with the RWD, RWE. And I would like to show you what we have achieved. This slide is quite clear to everyone. We have spoken much today about RWD and why they are required by all, but that's not all the users who need RWD. There are many more of them. Below, we have shown American Association, European Association, who understood many years ago that the RWD is a very good information and it can be applied in many aspects. Well, in our situation, in our country, the situation is different. It is not yet so evident, but we are here to advance RWD in our country. We want to make them understandable, important. We make them to be an integral part of our life, because everything should be digitized. Yeah, we live in a digital world. And the abbreviations that you see on this slide, there are much more of them. And this abbreviation, I sometimes get confused, but there are really very many digital systems that are compatible or not compatible. In any case, everything should get into our uniform government system, automated system of health care. But nobody yet knows in what way RWD will get there. So now the main objective is to integrate it all into one system. As to investments in digital healthcare, 100 billion rubles, 100 billion rubles is to be invested for the next several years. Yes, 100 billion rubles are to be invested in the digitization of the healthcare. Now let us see how it happens in reality. Money is money. But this is only oncology on my slide. This is the Russian cancer register and some territorial clusters, register clusters. This slide is to show the variety or the diversion of different systems in different regions. And the rounds you see here, circles, is like stars in hotels. 4 circles means that the number of informational systems that are to be integrated, that are to be made compatible, the number is really very huge. 1 circle is more or less, for example, in Nizhny Novgorod, there is 1 circle only, and this is the feasible task to harmonize all these systems. As to other regions, like in Tatarstan, this is a huge problem. And I would like to show Tatarstan. It is taken from the Tatarstan Healthcare Ministry. This is their site. and the red color is used by our colleagues, they honestly show that since 2013, when they try to integrate the systems on the level of not one medical institution, but the level of the entire republic, everything went not the way they expected. And they didn't achieve a good success, even on the level of one very advanced, digitally advanced region. Well, you shouldn't read it. It just I would like to show how difficult. So, how many systems are used? How many systems are you to marry in the Republic of Tatarstan? What can business offer in this situation? What are we doing as a commercial part of this segment? These are several figures that we have reached for 12 years of our work, about 55 million patient years of follow-up. So this is clinical information that is kept on our service, a huge information, and something is supposed to be done with it. But as an example of this is an example of our specific life, the register of diabetes mellitus that was created in 1996. That was the target program. It ended at 2012, but a huge amount of data was accumulated. We received it and began to work with it. 200,000 doubles is not so much, but there were triples and others. So the maximal number of doubles is one patient was registered in the register 8 times. But we reduced the reporting time from 90 days to 3 seconds. This is an amazing fact, it seems to me. So we are showing you the results of our work with this diabetes mellitus register. So the absence of legislation or the lack of legislation is the biggest minus, is the biggest disadvantage, the biggest barrier. We very often face in our work. We do a good job. We give people real instruments for work, but the question arises, and why is it? What is it for? How we're going to? Yeah, we say that personal data is very important, but nevertheless, a lot of questions arise because there is no such a notion as a register in the Russian legislation, no other essential concepts, essential terms. In-house information centers are installed in the different institutions, but the doctors have to introduce one and the same information many times because it doesn't appear in the uniform system. So the registers, we all know that there are two different notions, the register and the list. But in Russian, sometimes these notions are mixed. And we have to explain it to the clinicians in real practice. Our vision is that we must at all conferences speak about the necessity of introducing real-world data into the real practice to use the experience that has already been accumulated. Here you see the structure of the register that we suggest using in oncology. As to the clinical module, it is red in the slide. We are working with it. That is, we would like to add some other elements to it that would allow to make a universal system on the base, not on the basis of the statements, but on the basis of our 12-year experience and working instruments. And in conclusion of my presentation, I would like to give the so it's over Dr. Lukina. She's using the register. 94% with Gaucher disease are placed into the register. And she said that this is a rare case when the situation with treatment of this disease is better in our country than in other countries. So we see that there are some very working instruments, and our joint activities will make RWD legalized and wanted by all the participants of the healthcare market. Thank you very much, dear colleagues.